Edition of Professor Speaks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern. And today we're going to be talking about market consolidations and what exactly that means. Well, there's been a huge shakeup in the healthcare market with CVS buying Aetna, Cigna buying Express Scripts. So what exactly does this mean for the public?
It means that there will be, in the big market,
right,
in those employers that have large programs, maybe not for really small, but definitely for the big market, there'll be less choice. Okay. And they'll have to depend on the number of choices that these plans offer. And
does that mean higher prices?
It could.
Wow.
It could. It also means that there will be probably more pushing to certain PBMs or certain pharmacies that also own PBMs,
right? Like
CVS pharmacies, etc.
And just in case you don't know, PBMs are pharmacy benefit managers. But go ahead.
But so there'll be more shifting of patients to those. There's already some complaints in the marketplace where retail pharmacists are complaining that some of the plans are incentivizing people to go to some of the chains. So some of that will be very common. For example, a lot of the school systems have it where they've signed up with a particular plan, and so you're incentivized to go to particular pharmacies.
Right.
And so that means that you will, you may have a lot of choice because the pharmacies are all over the place. So access may not be the problem, but you may have some issues because you have to go to those pharmacies to get your prescriptions.
Right. Well, some of the things that we've seen, like Amazon and JP Morgan and Berkshire Hathaway, I mean, those aren't usually the ones you'd see in the healthcare market. But them coming together has seemed to do a little shakeup in the healthcare market, right? It has.
Yeah. And the issue here is technology over issues in healthcare, meaning doctors haven't been standing up, pharmacists haven't been standing up, nurses, hospitals haven't been standing up and saying, we have to change healthcare, we got to do all these different changes, etc. Right. Technology, on the other hand, is coming in and saying, we're going to have an app for this so that you can deal with prevention and prophylactic at home in order to try and keep your health, whether it's weight loss or keeping your blood pressure in control or something like that.
Right.
And technology also deals with big data, so data can be used like we do.
Right.
But technology, data can be used to make choices because you have a lot of data. You can make choices and see people tend to choose one particular option versus another. So they will tend to use that data in ways to try and drive people around. And that whole issue with Amazon then is to try and come up with options where they can cut out some of the middleman fees, squeeze doctors, squeeze pharmacies, squeeze hospitals in order to try and get better costs.
And this data can be used for not only for tracking in the past, but you could also project in the future what, like whether you should wane off of a particular drug or check your results of your test score, like when diabetes patients get a hold of the blood glucose levels, you can help track and maintenance that. It's actually pretty exciting. Think about
it is, yeah. And without seeming overly internal, we deal with a lot of that stuff, and we see that there are opportunities here to improve healthcare by appropriately identifying, communicating with doctors in order to have them make changes.
Right.
Letters to patients that tells them what to do in order to make those changes.
Right.
Analyses for pharmacies to say, get involved in the process and evaluate these patients and make changes, etc. So yeah, big data can be used in a very useful way to create change.
We've talked about that in the past before, about pharmacists actually taking more of how would you say, a more interactive level with the patient, like talking to them and communicating to them about some of the uses of this drug or why this drug was chosen over that drug, that kind of thing. Can technology also intervene in that instance and also provide another level of helping the patient get more knowledgeable about what they're taking.
Typically, historically, pharmacists were involved in dispensing the drug.
Right.
But with the advent, I mean, certainly it happened before, but with the advent of Medicare and Medicare Part D, it said that pharmacists could get involved evaluating the patient, identifying drug interactions, evaluating for polypharmacy when somebody was on a lot of drugs, and trying to identify if they needed all those drugs or discontinue some and deal with it or switch it to a less costly option. All of those things occurred, and now it's being expanded to deal with patients that are not just Medicare patients, so that everybody can address it, and pharmacists are critical in that process because they see the patient. For every time they see the doctor, they see a pharmacy at least 3 times for every time they see the doctor. So there's more access. They're readily available, and depending on the process and what is being looked at, they can make recommendations. Now, technology is saying if there were problems between a pharmacist getting a hold of a doctor, now they're saying, well, we don't need to worry about that. The technology can deal with that communication and can deal with it. And that's the same kind of things that we did in setting up technology where it was all digital. So you cut out as much of the manual process as possible so that you're making it easier, faster, less expensive, and you can do more. You can see more patients and deal with those kind of problems.
Now, could that potentially lead to some problems? Could that be dangerous in the future with seeing less of the patients or anything like that?
Well, let's be clear. The issue here and what's going on is that people are moving to try and deal with consolidating, which is a result of uncertainty.
Of course.
There's so much uncertainty in the healthcare system. If you bulk up and deal with it, then the plan and all of its alternatives are more in control. So they effectively are countering some of the uncertainty. Furthermore, as these plans in pharmacies consolidate, or United buys the DaVita physician group, what's happening is you're putting all of these people closer together. They have more control of what the costs are. They're eliminating the middleman costs. And so as a result of that, what you're seeing is more transparency where everybody knows what the cost is, and so effectively they can control that. What's the matter with that? Well, choice may very well go away, meaning you only have certain options and you have to pick those options. Furthermore, if people want a skinnier health plan than what's available, that skinny health plan may be fine and you pay for it, but you may not get very much for it. What we've learned in the Affordable Care Act world since 2008 is that when you give people something, they want it and they don't want to give it away. But more importantly, they want everything. So you can't say, well, you're only going to get physician office and a low copay, but if you go to the hospital, you're going to pay a lot. For labs, you'll pay a lot. For x-rays, you'll pay a lot. That doesn't work. So there will be issues potentially with health plans where there can be greater cost. Maybe the premium will go up because the plan will control more. But more importantly, it may be that the plan may be relatively inexpensive, but then there'll be a higher cost for lab, a higher cost for x-rays, a higher cost for other treatment.
And it seems like these health plans and PBMs have found a kind of like a workaround where the people, general public that are knowledgeable about this situation would say they want more transparency, right? They want to be able to know what the costs are. But if they know what the costs are and there's no other alternatives to choose or to shop around for the best price, what are we left with?
We're left with the public that may or may not be happy with the result of what they get. All of this uncertainty, maybe I'm only making a comment, but it may be that this whole issue of uncertainty is driving us to a universal health care where people get everything, and then there's a big argument between conservatives and liberals about what government's role is and how much government has to pay for that.
Right.
Irregardless, once you give people something, you can't take it away because they have it and now they want to see it. Well, if you have all this consolidation going on and there's less choice, then you have less choice, and now it may not be government regulated, but it's plan regulated, and therefore they can decide what the prices are, etc. This may be overemphasis on it. They may do an outstanding job and cut the costs and deal with it, because one of their roles here is to control the pharmacy benefit manager, who's the middleman, control the doctor. And a lot of this is to control the doctor's pen, because if the doctor has been using their pen to prescribe and therefore make more money, then what the plan idea is to control that and say, no, now you're part of us, you may be a staff member for us, so now you can't use the pen in order to increase it. So that could be a benefit.
Yeah, I mean, of course, we're just talking in terms of how dangerous it can get, but could also be potentially effective and helpful to the people.
It could be. Yeah, it could be.
Moving on to another key point I wanted to bring up was Amazon buying Diplomat. Has that gone through yet? Or
no, there's just been people talking about it.
Right, and Diplomat is a specialty pharmacy, right?
Diplomat's a specialty pharmacy. So if you look at it, Amazon became well known that they were going to enter the drug market.
Right.
They got involved in about 26 states with wholesalers. But they weren't necessarily drug wholesalers. They were wholesalers that would deal with perhaps over-the-counter products, certainly devices and things like that. Yeah. Well, one way for them to get into the market right away is to get a hold of one of the largest specialty pharmacies. And Diplomat is one of those. So there has been talk. Amazon certainly has all the money in the world. They could go in and buy Diplomat and therefore automatically be in this specialty marketplace where there's a significant amount of cost going on.
Yeah, how would that work? I mean, these are the highest priced drugs in the market right now.
Well, Amazon would effectively work on their distribution network so that people could get the drugs easier, faster, and cut down on a lot of that distribution cost.
Right.
Clearly, they would be involved in the negotiation with Pharma over the cost of drugs. And because they've already been involved in bulk purchasing, whether it's books or electronics or whatever.
Or anything else.
Or anything else. They could apply it, right? Because they're already pushing out groups for toys and things like that, like Toys R Us and all of that.
Not anymore.
Not anymore.
Toys R Us, not
anymore. Toys R Us is gone. But the bottom line is that they can use that purchasing power to lower the cost, cut out the middlemen, and deal with it. And if they own the ultimate provider, the same way that the health plans, United buys DaVita Medical Group and things like that, then they own the ultimate provider and they can say, no, your cost won't be X, it's going to be X minus Y.
Right.
And cut that. So there is a option here. It's probably not a bad idea when they think about it. Whether that's part of their plans or not, who knows?
And you would
but
hope
people are already talking about it.
And you hope they don't add it to the one-click add to your shopping cart kind of thing.
Well,
there's got to be some kind of vetting process behind that.
Well, they could, right?
Yeah.
But what you want to do in specialty is kind of like what we've done in all of our specialty analyses for our clients. Identify what the transaction problems are and fix them.
Right.
That cuts out a lot of cost. Probably somewhere in the range of 40% of the cost.
Right.
The second issue is to go after the distribution network and cut out a lot of that distribution cost. And clearly with what they're trying with all of the warehousing, drones, and everything else cuts out a lot of that distribution cost. And then the third thing is to go after quantities and day supply, which we see all the time, where they have massive quantities that the person probably isn't going to use, may very well stockpile the drugs. And so people are paying for it, but in fact people aren't using it.
And leads to waste. Yeah.
Leads to waste. So it's an opportunity then for them to say, we'll cut that out. And that'll cut it out. Now, it won't take a really expensive drug and turn it to zero, but it can cut out a significant amount of that cost maybe 40-50% of it. It'll still be expensive, but it may cut out a lot of that cost so that people look at it and say, well, maybe Amazon has found a way in order to try and regulate that.
And hopefully they avoid a lot of that fraud, waste, and abuse that's going on too, right?
And if you look at it, I mean, we do it, but fraud is horrible.
Yes.
But it's a very small percentage of what goes on. The real issue here is in waste and abuse. And as the federal government and CMS is identifying, so the state governments and Medicaid, if you can prevent it, then you cut the cost. So that attacks some of that problem in the waste and abuse. It doesn't stop a bad actor from doing bad things in fraud. But it certainly has the opportunity to cut out a significant amount of the waste and abuse, and that is a significant cost to what goes on. At minimum, that's 30% of the cost of everything.
Yeah, and with Amazon, before you purchase something, you have to identify yourself as a person, and it's related to usually a card, and you don't pay cash on Amazon, so that can eliminate a lot of this anonymous people getting prescriptions.
Unless they're, stealing credit card information or, or electronic PayPal information or whatever in what they do. I mean, that's never going to go away. There's still going to be bad actors. But still, you're trying to cut some of that out.
Yeah, definitely. Well, that's all we got for you today, and we definitely wanted to touch on the topic of market consolidation, and a lot of it is going on behind the scenes, and you'll see it a lot in the news. It won't make headlines, but it's in the news. So if you have any other questions about it, please feel free to message us, comment below. If you like the video, please share with a friend, and please visit ProPharmaConsultants.com. We have a free healthcare information page called RxInfoX, and we will have a new video for you next week, and we'll see you then. If you like this video, please hit subscribe. If you don't like it, still hit subscribe.